Goeienaand, good evening, fellow South Africans and citizens of the world. And for those many new subscribers to the Loving Life channel, we had something like 1,000 new subscribers in the last week. Please be aware that I have two very big YouTube channels. And the main Loving Life channel, which you run right now, basically is more just information, such as what's happening in South Africa, about the coronavirus and so on. The more, I guess, dramatic videos are in the Loving Life 2020 channel, which I'll actually put a link down directly below this video, or right at the end of this video you'll see the little Loving Life logo in the bottom left-hand side. If you click on that, it'll say subscribe to Loving Life 2020. So if you click on that and then subscribe, you're then a member of both Loving Life channels. So please make sure that you are a member of both Loving Life channels. Now, for example, earlier tonight, I put up a video about the coronavirus with some very, very dramatic video footage, including from the BBC and raw footage from Wuhan, which is the center of the coronavirus. So if you, again, click on the link directly below where I actually say Coronavirus Loving Life 2020, you'll be able to go and see that video. It goes for about 35 minutes because it's got a lot of information that's very, very important to you. Also about how to prepare for this. Okay, the subject of this video is how countries are now starting to prepare for the coronavirus arriving in their region. And of course, South Africa don't have a clue what they're doing. They're just, it's way too complicated for the South African Health Department, sadly. Okay, this is what's happening in Canada. As novel coronavirus outbreaks spread across a growing list of countries, Canadians are being warned to prepare for a possible pandemic. In a shift from previous messages, Chief Medical Officer of Health, Dr. Theresa Tam, acknowledged Monday that Canada may no longer be able to contain and limit the virus if it continues to spread around the world. She said governments, businesses, and individuals should prepare for an outbreak or pandemic. Dr. Vera Etches, the City of Ottawa's top health officer, said on Monday, "We are coming to similar conclusions. It looks like it's going to be more and more difficult to contain this virus, and it may well evolve into a pandemic. That would change the efforts to contain every last case and contact." Etches said people can take steps now at home and at work to prepare. Some of those steps include stocking up on needed prescriptions ahead of time, so there is no need to do so during a possible pandemic. She also recommended people stock up on non-perishable foods. Imagine if someone was ill for a week, what would you need? She said there are ongoing discussions about setting up an assessment center outside of hospitals to reduce pressure on the health system. The global risk situation is evolving, said Tam, noting that the novel coronavirus, or COVID-19, has grown beyond its epicenter in China to include rapid community spreading in several countries. The window for containment is closing. These signs are worrisome. It's gone. They can't contain this virus. It's gone global now, and it is in South Africa, believe me. She made the comments shortly after Ontario and British Columbia confirmed their latest cases of novel coronavirus, bringing the Canadian total to 11 people. In Ontario, a woman in her 20s who returned to Toronto after traveling in China is the latest presumptive case. The patient has only mild symptoms and has isolated herself, say Ontario health officials. Health officials are also tracing contacts after a woman arrived in Vancouver from Iran by way of Montreal with novel coronavirus. A man who was a close contact of the woman has since been confirmed as the country's 11th case. Iran is now home to an epidemic with 13 confirmed deaths, according to the government. I've heard reports that there are actually 50 deaths in Iran. Italy is the size of Europe's first outbreak. The country locked down at least 12 communities and cancelled a Venice carnival after 6 deaths as of Monday. South Korea also has a growing outbreak, as do a number of other countries. Now, South Korea has nearly 1,000 cases or reported cases of coronavirus. It's probably a lot higher. On Monday, Tam said it's possible novel coronavirus is present in countries that don't have the capacity to detect and monitor it, which makes trying to identify potential cases coming in Canada at the border increasingly difficult. Now, one of those countries that really don't have the equipment to test for coronavirus is South Africa. Countries like Canada have so far succeeded in identifying and containing the virus to a few, mostly mild cases, but there are more and more countries involved, she said. The border measures used to identify potential cases might no longer be effective or feasible. Get that? No longer effective or feasible. This is something we have to prepare for. Tam said the quickly evolving situation tells Canada and other countries that we have to prepare in the event of more widespread transmission in our communities. Given the global situation, Tam said it will be very difficult to stop the virus from spreading, but slowing it down is Canada's goal. Delaying the onset of broader outbreak in Canada could put it beyond seasonal flu and virus season, which would take pressure off the health system and give officials and individuals more time to prepare. A delay would also allow health officials to better understand the novel coronavirus and give researchers more time to look for treatments. We are trying to push past winter respiratory season. That will help a lot. The World Health Organization is telling countries to prepare as if COVID-19 is a pandemic, although it has not as yet declared one. Etchers, meanwhile, said people should be prepared in the workplace as well as by ensuring someone else is available to take on necessary tasks if an employee is sick. Etchers and other health officials continue to encourage people to wash their hands regularly and practice keeping their hands away from their faces to prevent spread. There have been no cases of COVID-19 in Ottawa. To date, 25 people have tested negative. Etchers said 1 or 2 people came to the attention of Ottawa Public Health every day and are assessed as to whether they meet the case definition for testing. In Ontario, 540 potential cases have tested negative. 9 are under investigation. 3 cases have not resolved, and there is 1 new presumptive positive. British Columbia has had a total of 7 cases. Meanwhile, the remaining Canadians repatriated from Wuhan and quarantined at Trenton Air Base are due to head home. In Cornwall, at the Nats Centre, 129 Canadians are being quarantined after having been evacuated off the Diamond Princess cruise ship. In Japan, 48 Canadians who were aboard the cruise ship are being treated for symptoms of COVID-19. 34 of the former passengers are hospitalized, said Tam, 2 of them in critical condition. Globally, there have been 79,331 confirmed cases of COVID-19, 77,262 of them in China. There have been 2,595 deaths in China and 23 deaths outside China, with cases in 30 countries. Okay, so there you go. That's how seriously Canada is taking the coronavirus. They have a far superior public health system to South Africa. When it comes to South Africa, guys, it's going to be shocking beyond belief. Just be aware of that. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. Bye for now.